name is Tyler. I'm a registered nurse, and I'm going to perform a comprehensive health assessment on my patient Sandra here. So this is Sandra. She's a 58-year-old Caucasian female. Sandra, can you tell me your name and date of birth?
Sandra K. Rolls, 12/6/59.
And do you know where you are today?
Yes.
Where are you?
Home.
Do you know what month it is?
Yes.
What
it's
month is it?
December.
Okay, good. So she is not in any signs of distress. She's a petite body structure. All of her body is symmetric. Her face is symmetric, all symmetric movements. She's erect in her posture, and she has no physical deformities. Now, Sandra, would you be able to stand up and walk across the room for me and come back and sit down?
Yes.
So she has a steady gait and no issues walking. I'm now going to assess her cranial nerves. So for cranial nerve number 2, you assess using the Snellen eye chart, and she often visits a optometrist, and I do not have a Snellen eye chart available, but I would have her read that if so. So for cranial nerves 3, 4, and 6, I'm going to have her follow my finger into the 6 fields of vision. So just follow my finger and keep your head still, and just follow with your fingers. Good. No issues with cranial nerves 3, 4, and 6. So for cranial nerve number 5, it's her facial sensation. I would normally use a cotton ball to do this, but I do not have one available. So tell me if you can feel this here.
Yes. Yep. Yep.
Cranial nerve number 5 is present and no issues. For cranial nerve number 7, I'll assess for facial symmetry. Can you give me a big smile? Smile is symmetric. And can you raise your eyebrows as high as you can? That is symmetric. And close your eyes as tight as you can. So cranial nerve 7 is present and no issues noted. Cranial nerve number 8, I will use a whisper test to assess for. Repeat what I'm saying after me.
Hello? Goodbye.
Good. No issues with cranial nerve number 8. For cranial nerves number 9 and 10, I can just assess for a swallow and see if there are any issues with Sandra swallowing. Go ahead and give me a big swallow. Good. Cranial nerves number 9 and 10 are present. So for cranial nerve number 11, I'll have you turn your head and try and push back with some resistance for me. So I'm going to have you turn your head to the right and try and push back with some resistance. Good. And we're going to do that on the same side. Go ahead and push. Good. Now go ahead and raise your shoulders while I give you some resistance. Good. So cranial nerves number 11 are present. And for the last cranial nerve number 12, I'm just going to have you extend your tongue out as far as you can. Good. So all cranial nerves are present and intact. Okay, Sandra, now we're going to take a set of vital signs on you. So when we are assessing for vital signs, we're going to look for her temperature, her pulse, including the rate, rhythm, and force, her respirations, her blood pressure, and her height and weight. So to start, I would check her blood pressure. I do not have a blood pressure cuff, so I'm not able to assess it, but her blood pressure is normally within normal limits. Her temperature, I would normally take it with a thermometer, either temporally or orally. I do not have either of those, but she has not been running a fever lately. I can't assess her pulse. I'm going to check it radially here and check for rate, rhythm, and force of it. So I'm going to take my 2 fingers and I'm going to place it radially here. I'm going to assess for a minute. Okay, so you assess for a minute, and her rate is around 80 beats per minute, good force all around, and a regular rhythm. For her respirations, for the last 30 seconds when I'm assessing her pulse there, I would be assessing her respirations for the rate she is breathing and if she's using any extra muscles to breathe, and she's breathing within normal limits and no accessory muscle use. So now we're going to get her weight. I have a scale here we're going to step onto. Sandra, please step on. Okay, we have a good weight. Go ahead and sit back down. And how tall are you normally, Sandra?
4'10".
Okay, so she is 4'10". Alright, Sandra, so now we're going to assess your head, neck, eyes, ears, nose, and mouth. For your head, I'm just going to inspect your skull to see for any symmetry and any abnormalities. So I'm just going to assess around your head here. No abnormalities with your head, and I'm going to assess your temporomandibular joint. Just going to assess here. Can you open your mouth for me and close it? No issues with temporomandibular joint. There are no involuntary facial movements of her face. So for her neck, I'm just going to inspect and palpate it here. There are no issues noted whenever on inspection. Whenever I palpate it here, I'm going to palpate for her lymph nodes. There are no hard lymph nodes. No issues on palpation. Her trachea is midline. Whenever you palpate her thyroid, it is palpable. So for her eyes, I already assessed for visual acuity with the Snellen eye chart. So for also her eyes, I have a pen light here. I'm going to assess her pupils if they're round and reactive. She does wear glasses here, so I'm going to take those off quickly. Just keep your eyes forward, and I'm going to shine a light in your eyes. Her pupils are round, reactive, and equal. So I'm going to inspect her eyebrows and her eyes and her eyelids and eyelashes. So can you close your eyes for me? Her eyelids come down and meet and her eyes close nicely. Can you open them nice and wide? Good. Her eyelids close, good. Her eyebrows are present. Her pupillary response is present. So for her ears, I'm just going to inspect her outer ear canal and her tragus. If you palpate that, there's no issues there. Go to her left ear. Palpate the trachea. Do you have any issues with your ears and hearing?
No.
And normally you would use an otoscope to visualize the tympanic membrane. I do not have one available to assess for wax buildup or anything in her ears. So for her nose, I'm going to inspect for symmetry of her nose and deformity and lesions and patency. So her nose is symmetric on both sides. Have you been having any trouble with your nose, any drainage or anything lately?
No.
No drainage present. Do you have any trouble breathing through your nose?
No.
Have you ever had a broken nose?
No.
So her nose is patent and no issues with that. I would usually use an otoscope again to assess inside of her nares, but I do not have one available. So her septum, you can see in her nose, she's never had a broken nose or any history of septal defects, so she doesn't have any issues with her septum. Also, lastly, with her nose, I'm just going to palpate her sinuses here to see if there's any pain on palpation. Any pain there when I push?
No.
I'm just going to push up here too. Any pain there?
Nope.
And lastly, for her mouth, I'm just going to assess with this pen light again. I'm going to have her protrude her tongue and say ah, and I'm going to look at her uvula and palate. So I'm just going to push this light in. Can you push your tongue out and say ah?
Ah.
Okay, her uvula is midline and her palate raises there. Continuing on our comprehensive health assessment here, I've assessed her skin, hair, and nails. There are no issues noted. Her hair is evenly distributed. Her skin on palpation, it's warm and dry, and she doesn't have any open areas on her body. So we're going to go from head to toe here, and I'm going to assess her heart and lungs now. Have you had any issues breathing or any palpitations lately?
No.
Okay, so I'm going to assess your lungs. Can I have you lean forward for me and take a few nice deep breaths throughout your mouth? Two more. I'm now going to assess your heart sounds, so just breathe normally. Got to listen to your apical pulse. I'm also going to listen to your heart over here. I'm going to listen to your carotid arteries here. Her lungs are clear on auscultation, her heart sounds are present, I can hear her apical heartbeat, and there are no murmurs present.
3.
For the breast examination, Sandra performs self-breast examinations and reports no abnormal findings from that. So next, I'm going to assess all her joints and muscles. So I'm going to assess your range of motion here. Are you able to move your shoulders back and forth? Good. Can you do with your elbows, flex up again, okay, and then roll your wrists out? Okay. Now can you put your arms straight out like this and push up on my arms? Okay, good. And then push down. Good. Push your arms like this. And push out. And then push in. Good. And I'm going to have you grab my 2 fingers and squeeze as hard as you can. Good. So all our upper extremity joints are intact and no issues noted. So for our knees, are you able to bend in and bend out?
Mm-hmm.
Bend in and bend out. And with your other, bend in, bend out. Okay. I'm going to palpate your knees here. No inflammation or pain with those. And you're able to extend your ankle out and in. Good, good. And with your left. Okay. Also going to palpate these. No inflammation or pain with palpation. Next, I'm going to assess your peripheral vascular system. So first off, I'm going to palpate her radial arteries. Her hands are nice and warm. They're pink. They have gray cap refill, less than 3 seconds. I'm going to palpate her arteries here. Good pulses all around. So now I'm going to assess her feet. Again, she's nice, pink, and warm. Good cap refill, less than 3 seconds. And I'm going to assess her pulses. Her pulses are present and strong. And as you can see in her legs, she doesn't have any discoloring in her legs. There's no edema present. Skin turgor is normal. And there are no lesions present on her legs. For the next part of my assessment, I'm going to have Sandra lay supine and I'm going to assess her abdomen. So can you please lay on the floor on your back? Okay, so first, are you having any issues with your stomach or
No.
abdomen? Any pain anywhere?
No.
Okay. So I'm going to auscultate her abdomen and assess for bowel sounds in all 4 quadrants. Bowel sounds are present in all 4 quadrants. Now I'm going to light palpate and heavy palpate her abdomen, and if you feel any pain anywhere, just tell me, okay?
Okay.
Any pain there?
Nope.
Any pain there?
Nope.
Any pain there?
Nope.
And there?
Nope.
How about now?
Little bit.
Okay. How about now?
No, it's not too.
Any pain there?
Nope.
And any pain there?
No.
Okay. So no pain to palpation. She's not having any issues with her abdomen. There are no issues on the skin of her abdomen. All bowel sounds are present, so our abdominal assessment is negative. Lastly, Sandra has no reported issues with her bowel habits or her urinary system. I have finished with my comprehensive health assessment and I have found no issues with Sandra's health. Thank you for being my patient today, Sandra.
You're welcome.